the building is burning. Most people ran this way, but some of these first responders, they ran right into it.
Amen.
I found myself in the same mode. First few weeks, I said, well, surely Harvard will tell us what to do, or the Mayo Clinic, or maybe the U.S. government. Usually the government on medical things is a laggard.
Mm-hmm.
They're not a leader.
Mm-hmm.
So if we had a new cancer problem, we wouldn't say, well, what does the government say? The government is behind academia.
Got it.
Within a few months of being into the pandemic, I said, listen, I need to do my part. I know other doctors in the hospital are doing their part. And I devised the first treatment protocol of how to treat high-risk patients. We're talking elderly patients, patients with heart disease, lung disease, kidney disease, at home with very intensive therapies and oxygen at home to avoid two bad outcomes, hospitalization and death. And that became copyrighted as the McCullough Protocol. It was published in the American Journal of Medicine in 2020. Immediately, I was called before the U.S. Senate. I appeared November 19th, 2020. And so the Association of American Physicians and Surgeons, a leading doctors group, did pick up the McCullough Protocol. It became standard of care. And the principles were used.
It became standard of care when? Because it was...
No, it became early standard of care in 2020 for high-risk patients. We immediately organized telemedicine units, and it was the McCullough Protocol that kept the hospitalizations down. Remember, there were projections that we were going to overrun our hospitals.
Oh, yeah. They were like emailing people, like, do you have a place we can put bodies at your house or whatever?
I had patients in their 90s with pacemakers and heart failure, and we got going early with the McCullough Protocol. We start with getting fresh air, nasal sprays and gargles, nutraceuticals. They all played small roles. Initially, the first year we used hydroxychloroquine as our antiviral and antibiotics and other drugs. Second year, ivermectin. And then third year, we actually used Paxlovid came in the third year, molnupiravir. We used those drugs. But I have to tell you, the winner was ivermectin, for sure. But I think corticosteroids, prednisone played a huge role. An anti-inflammatory drug called colchicine we use widely today, and then anti-thrombotics.
What was the McCullough Protocol? Like, what went into it? Like, what were you basically advocating for people?
I was saying that if we got behind on this illness, it was becoming clear we can't start treating when people are sick enough to go in the hospital. Virtually every death occurred in the hospital. So McCullough Protocol said there's two bad outcomes, hospitalization and death. And if we can treat up front and never go in the hospital, we'll get through the illness. Now, I did an artificial intelligence search recently, which is a great use of AI. And I asked AI, tell me what % of the world's population contracted COVID? And it searched every single database and what have you. And, the number it came up with was 90%.
Wow.
Now, the pre-programmed bias that's still left in AI is promotional of pandemic fear, which you're still at risk, promoting vaccines, and doing everything it can to tell people they have no other options.
Right.
It's pre-programmed. So if you go to Grok...
Is that true?
It's true. Let me give you an example.
Okay.
If you go to Grok and you say, who's Dr. Peter McCullough? It'll say, well, Dr. McCullough is a cardiologist, and it'll go on and on. It'll say, but... he's a conspiracy theorist, and he was lost his board certifications. It'll start saying all these things. I said, listen, just say who it is. Don't put in any defamatory comments. Just give the straight facts. Then it'll actually give a straight answer. So Grok will tell you, I'm the most published person on the pandemic, period, in the world.
Okay.
And, and so if you actually tell Grok, stop all the BS, it'll do it. With Alter AI, you don't have to do that. So at McCullough Foundation, I started a foundation. We formed a relationship with Alter AI, and we pay for it, and we get a clean feed. But I think even Copilot will come up with formerly practicing. No, I'm in practice. I just saw patients yesterday. I mean, look at it. It just goes on and on.
Dr. Peter McCullough, formerly practicing as a cardiologist and internist.
Wrong. Because I'm practicing today.
He is highly published in medical literature, over 1,000 publications, cited tens of thousands of times, became widely known during the COVID-19 pandemic for his early advocacy of outpatient treatment protocols, including controversial early use approaches, and for his strong public criticisms of COVID-19 vaccines. Yeah.
Okay, well,
See, this seems...
It's getting there. You know, think about artificial intelligence, which I think is a huge advance. By the way, I'm using it in my practice every day now. Huge advance.
One more thing here. His views on COVID-19 vaccines and related topics have been heavily criticized by mainstream medical organizations, fact checkers, and sources like factcheck.org, which describe many of his claims as misinformation or unsupported.
Do you know not a single medical organization has reached out to me even for a discussion? And, you know, factcheck.org, that's not a medical organization.
No idea what that is.
So the idea is, let's say a medical organization said, let's have a discussion about COVID vaccine complications. Not a single one. There hasn't been a single medical school in the United States that's even had a grand rounds on this, let alone invite me to present grand rounds.
Why do you think that is, that they haven't reached out to you to have a conversation?
They haven't reached out to anybody.
Okay.
There is a tremendous willful blindness to what's gone on through the pandemic. There has been no review of lessons learned. What did we learn from the pandemic?
I agree. It's so wild how so much information was every day. It was this, go here, get a booster. If you can't get a vaccine, hang your family member out of a window. We'll have an archer come by with a vaccine from Pfizer. Yeah, it was we can, we'll vaccine them from the road or whatever. It's it was getting crazy. But yeah, it's kind of wild how afterwards there hasn't been as much hey, these are the things we learned. This is what we've learned as a society.
Well, we're told over and over